Good afternoon, Miss. I want to presentation of today. First of all, I would like to introduce myself. My name is Susi. My study number is 190106145. I want to the presentation today. Case study. Case study 2, spinal injury. Nancy, 42 years old woman has suffered from paralysis and numbness in her left shoulder, arm, and finger tips. She has normal cardiac stress and EEG. Her MRI test showed the cervical nerve compression in the main cause of her paralysis and numbness. The neurosurgeon has scheduled anterior cervical discectomy using ACDF for her. Previously, she has suffered from hypertension and hysterectomy. She also consumed ethanol for her medication. Objective, objective and subjective data. Subjective data, paresthesia and numbness in her left shoulder, arm, and finger tips. She has suffered from hypertension and hysterectomy. She also consumed ethanol. And objective data, blood pressure 135 over 70 millimeter mercury, HR 61 beat per minute, respiratory rate 18 beat per minute, oxygen saturation was 98%, temperature 36.8 Celsius, hemoglobin was 13 over 2, hematuria 39 over 0.4%, electrolyte sodium 139, potassium was 30.9, calorie 104, carbon dioxide 24. This is a question. Why is talk assessment under patient cardiovascular function period ACDF surgery very important? An answer. In our opinion, thorough assessment of cardiovascular function is important before performing ACDF surgery because it allows the health professional to see whether there is a systematic disease that causes primary cardiovascular disorder or not. Moreover, checking the patient's general condition and vital signs, especially the ACD examination, must also be conducted prior to surgery so that the surgery can be performed well. And then number 2, the question is, please describe the importance of proper positioning for patient having IBCDF. An answer. In our opinion, the position of the ICDF Patient should be done precisely and carefully. The position of the patient head during extension and axial traction should be avoided in the ACD if patient may not immobilization of the neck and helped by an assistant. This position aims to neck stabilization during the treatment process to avoid stressful injury to the patient's cervical spine. And the question number 3, and the patient, what are the fluid or equipment necessary for patient having ACDF? An answer, in our opinion, the use of fluid in ACDF patient can be given according to the severity of the patient. Both crystalloid and colloid fluids in intravenous fluid administration should be limited to their use, which is used only for fluid maintenance unless there are signs of shock in the patient. And then last, number 4, the question is what are complications that can occur during the perioperative management of the patient having ACDU? An answer, in our opinion, there are some complications that may occur during usually accompany cervical spine fractures such as neurogenic shock, spinal cord trauma, and cardiac complications. And the conclusion, the initial assessment of patients with multiple trauma, especially those with cervical spine trauma, is to maintain airway, breathing, and circulation management. Possible cervical spine trauma should be considered in someone who experienced trauma to the face and head, especially if there is a loss of consciousness. There are severe complications and may occur during cervical spine fracture, such as neurogenic shock, spinal cord trauma, and cardiac complications. Thank you for attention.